South Africa has more than 3,600 reported cases of the coronavirus, and health officials there are bracing for more. But doctors may already have a leg up on this pandemic thanks to lessons learned during the Ebola outbreak. Our Debora Patta explains.
Eyes focused, hands steady, Dr. Yana Duplessis quickly inserts a tube down the throat of a dummy behind a plexiglass box. It's called the intubox, designed to protect frontline health workers treating COVID-19 patients.
We've created a hatch through which you can work through, and it opens away from the person doing the procedure.
South African emergency medicine specialist Professor Rosa Mutara heads up the team that developed the box for high-risk procedures like intubation.
The risk is when you're trying to do that intubation, you literally are over the patient. So if all that stuff, even with a mask and a gown, all that aerosolized material is then hitting you as a contact, whereas now it's in the box.
Africa has already had some success with a similar innovation when treating Ebola patients, a large plastic cube that protects medical staff from the deadly virus. Doctors insert their hands through the plastic to treat an infected patient without coming into physical contact with them. The Ebola cube was the inspiration for the smaller intubox, designed by the South African medical team and then modified by aeronautical company Paramount, which also makes parts for Boeing.
The intubox has already been used successfully on several South African patients. Now there is interest from a few US companies.
In fact, it took just 2 weeks from conception for the box to be rolled out to South African hospitals.
There's been research already that have shown that without the intubox, the staff that are actually doing the intubation are significantly exposed to viral droplet spread, because it obviously gets, pushed into their faces and onto their chest. With the intubox, we've actually managed to contain that kind of dispersion of the droplets.
South Africa is bracing itself for a spike in COVID-19 patients, and while desperate times call for desperate measures, they've also led to great innovations. Debora Patta, CBS News, Johannesburg, South Africa.